There have been a lot of advancements in the management of advanced liver cancer in the past year and a half. As everybody's aware, for the past decade, the only drug we have that had been shown to provide an improvement in survival in advanced liver cancer was sorafenib. That's not because of lack of trying. There was just numerous negative studies. That changed with the results of the resource study that showed that regorafenib improved survival versus best supportive care for patients who progressed on sorafenib. And this drug has been approved globally in that indication. Shortly after we saw the results of the regorafenib study last ASCO in 2017, we saw the results of the REFLECT study, which showed that lenvatinib, a small molecule inhibitor against the VEGF receptor as well as the fibroblast growth factor receptors 1 through 4, was non-inferior to sorafenib in terms of its primary endpoint of overall survival, but it did improve response rates, time to progression, and progression-free survival. And we are waiting for regulatory approval of lenvatinib at this time in the United States. Shortly after the results from lenvatinib in the fall of 2017, we saw the approval of nivolumab based on a phase 1 dose expansion study in patients who had had prior sorafenib. And this was based on a response rate of about 15%. But very intriguing was that these responses were very durable, with a median duration of response of at least 16 months. And we're waiting for a confirmatory study with nivolumab versus sorafenib in the frontline setting, the CheckMate 459. At the beginning of 2018 at GI ASCO, we saw the results of the cabozantinib study. This study looked at cabozantinib versus placebo or best supportive care after progression on sorafenib. And again, this was a positive study as well.